We'd like to think it does. I'm kind of notorious for that. Obviously the male, different things, but it's one of these things that it's the old what hump. It's like if you don't see it, it is there, and sometimes it takes somebody else to tell you about it. Your friend John, our friend John, was mentioning that some of the clothing after the mastectomy was very uncomfortable, and that was one of the things that you thought, if you could make a difference, we all like to in this world, you are, hopefully I have, to make a difference that somehow maybe there could be, because of your experience, maybe you could develop or help develop something that would be a little more comfortable, form-fitting, whatever,
Well, you do several trips to the hospital within that year, and every time I went, the unflattering hospital gowns, and I'm always saying, I wish they had something a little prettier, a little more comfortable, a little softer. So that's what I developed. We have really pretty special hospital gowns embroidered that, with the real soft, comfy pillows to match, because they don't tell you that you need these pillows after surgery. And my line, everything matches.
I was on your site today, before we forget, it's sherocksforcancer.com.
And we do a lot of charity events and fundraisers, and we gear towards the younger people. So we do things from the schools to leather, bracelets, and stuff for men as well. My boyfriend wore the pink ring and caught a wrath all the time, but he didn't care, and once he told people about it,
that's the first I heard about it.
Very cool.
I'm sure you.
I've never seen the male jewelry.
I've never heard of that.
So it's kind of a surfer-looking, with the ribbon carved out in the bone. So it's really not cancer in your face, but just to know that you're supporting someone, or the proceed that went from that item goes to the cause.
Now, obviously, since you live in Florida, we're thankful to have you up here. You're visiting, so that's why we kind of we got to get this thing before you go back. This is based in Florida, but do you do anything up here? I mean, if somebody, let's say, sees the website sherocksforcancer.com.
Absolutely, we do things all over.
Do you take it mainly over the internet, or is there a phone number? If somebody.
Both.
Okay, what would the phone number? I didn't see it.
It's 561-445-0081.
And Dr. Sheth, I mean, in the supportive world, and just, hopefully nobody has to hear your story. I hate to say it, but there's plenty out there. We all have a story, some less severe than others. But, what is the impact that you think this might potentially make in some of your patients? Because I don't know if this is really done. I mean, I'm sure there's support groups all over, but...
I actually asked for some pamphlets because I think the products are really nice. They're day-to-day wear too, so it's nice. But what it really does is, one, it gives you confidence that for the patients wearing it, that I'm a breast cancer survivor. It brings up a lot of discussion with other women or men that you may encounter. And I think it just overall raises awareness to people to say, you know what, you have a vested interest in your health and you need to take charge of that. And I mean, when Tommy went ahead and had her genetic testing and that changed things for her too, that's something that is not always discussed, and it's great that she went ahead and found out about it and did that. Oh, Tommy, thank you so much. This is a beautiful bracelet.
You're very welcome.
Great products.
Thank you.
A few months ago, we had Ed Pazahowski on. Do you know Dr. Paz? Okay. Very frequent visitor to the show. Dr. Cervoni, them two, I don't know who's ahead, but they're running neck and neck, and I'm sure you'll be on again as well. He did talk about, Dr. Paz's interest has kind of veered a little bit. He's into some of the natural healings now. But he did talk about one of the waves of the future for healthcare is genetic testing to tell what is the likelihood that you could be predisposed for something like this. Now, as far as genetic testing for breast cancer, I heard what Dr. Paz says. I didn't know it was part of that as well. I mean, it certainly doesn't seem to be mainstream. I don't watch a lot of TV, but I should at least click through it once in a while. How long has that been around?
Oh, a good 5 to 10 years where it's been used frequently. It's not a screening mechanism, though. It's only for patients who have been diagnosed, they have a family history of such, and then potentially the test can be done. And the importance of it is not so much just for breast cancer, but that gene also impacts the risk for ovarian cancer. So if patients are found positive to be carrying the gene, they have to not worry only about the breast cancer and doing a mastectomy, but potentially having a hysterectomy and removal of ovaries. So it's pretty critical.
Let's say, let's go back 3 years and you were Tommy's physician here. What are some things that Tommy definitely, and then this is true of anybody with breast cancer that's been diagnosed, what are some definite do-nots? I mean, are there some things either medications they shouldn't be doing, or even foods that maybe could stimulate more growth? I mean, is there something that you definitely educate your patients in? Yeah.
Cigarette smoking, if they are smokers, not to smoke, because that has been associated with breast cancer risk. Trying to maintain a well-rounded diet with minimizing fat content to about 20%, and just regular exercise and physical activity, because in those scenarios there is a higher risk of breast cancer. I think the support groups that you talked about are so key in terms of getting things in perspective and realizing that there's other women in the same boat, but at the same time it's also important to remember that every breast cancer is different, and you really can't compare your own to the next person, because there's so many little things that could make a treatment different for one person to the next.
Is reconstructive surgery always recommended?
I do.
You do recommend?
If they're going to have a mastectomy, I think it makes the transition from having breast cancer to going back to a normal life much easier.
How was your experience? I met your significant other off camera. I'm sure Steve was impacted as well. Did he, join you in some of the support groups, and did the men kind of bond too, with each other, or?
We tried to make that happen. A lot of times that, couldn't happen, but he would come with me to all my appointments, and all the chemotherapies that I went through. And it's good. You need somebody there just to hang out with and get you through it. He was very supportive.
God always has a plan, and sometimes through a negative. What positive did you take through all this, if anything?
Oh boy.
Besides surviving, obviously,
yes,
but
well,
3 years later,
just to take every day and be grateful.
you've changed.
Yeah.
You have to. What are some of the things you've noticed?
When you hit on basically how her significant other reacted, I think it's really important that family members do get involved too. But I've found over the years that patients go in two directions. They either want attention or they want to be left alone.
Right.
And so a lot of times I try to help them and the family members to say, you guys need to communicate. You need to figure out what's working best for both of you. And that's really key. And how to get children involved if there's children. And there's a lot of important books and websites through the American Cancer Society that they can use as resources.
Well, I just got the old peace sign. But that usually means here it's 2 minutes to go. Okay. So Dr. Sheth, let's, Tommy gave, I gave the website, you gave the phone numbers. Somebody wants to contact you at home, maybe make an appointment or go to a website to find out about you. And so if you have a website, let's do that. And also, let's say the Shelby office, or which one you want.
The website is www.ssofmi.com, and the phone number for the Shelby office is 586-685-2200, and the St. Clair Shores office is 586-771-8900.
The new office, did you design it? I know it was from the ground up. I mean, it's only, you're in there. I mean, I'm in there frequently, but maybe a third of the groups are actively in there, maybe somewhere along that line. Was there anything that you added to this office, since it is brand new? I mean, it's only a couple months old, to maybe help patients like Tommy, in their experience? Or was there something that you made a little different you don't have in the St. Clair Shores office?
What I absolutely love about the new office is the different disciplines that are in the office. So just like you were talking about multimodality, we have oncology there, we have radiology there, primary care is there. So it is possible to see all the different physicians, and you don't have to drive all over the place to get that attention and the recommendations. So, and it's a beautiful setting, it's beautifully done, it's very comfortable, it's convenient, and I love it.
Yeah, I just go there to chill. Yeah. I mean, it's pretty remarkable.
Absolutely.
Dr. Sheth, it was nice meeting you. We've seen each other from afar once, and Tommy, it was good to have you back in Michigan. You are a resident, we're born here. And this is a show that I knew we'd end up a lot of different shows. I didn't know when we'd hit this. You were in town, so we hit it. So
thank you for having me.
I think you have a story that unfortunately a lot of people know. Maybe you've helped some of them at home, with your story, because, everybody, there's strength in numbers. And when you went through something, you had some people helping you. Hopefully you've provided that for somebody as well today. And again, if there's any of the numbers that we've mentioned, I'm sure producer John usually puts the numbers, your website and the phone numbers that can get a hold of you. And as we always end this show, Dr. Darty Sheth, you were the doc is in.
Thank you.
Thanks for being here, Tommy.
Thank you.
Have a safe trip back.
Thank you.
Okay. We'll see you next time, everyone.